is really addictive. It's more addictive than cocaine. Porn on a whole leads to
Shit. For people who are suffering from premature ejaculation, what are the three things that they can do in order to
some people are having loose erections, some people are getting ejaculated at the time of foreplay itself, some people are not able to penetrate only. There are sexless marriages going on for 5 years, 7 years. Like a man's mind, he is not able to speak up for his problems. Can go through all the traumas, he can go through the divorces itself, but he won't get treated. These people will not tell anybody. These people will not go to a doctor because they have to take their underwear down. There is this nude couple yoga thing going on, and this is working crazy. This is working crazy. Trust me, there are certified trainers that are working for it.
maybe what would be one thing that people can do in India that would improve the sexual health? A lot of people might have fears, or they don't want to talk about. What is one question that normally people they feel scared or afraid to ask in this topic, but it's really important for their sexual health?
So, a question standalone cannot be a thing. So, there is this anxiety of acceptance. This acceptance anxiety is the thing that is conquering a man's mind altogether, and because of that he is not able to speak up for his problems. He can go through all the traumas, he can go through the divorces itself, but he won't get treated because somewhere there is a mard ko dard nahi hota. You must have heard, being in India for 4 years.
What does it mean?
That means a man is not supposed to feel pain. A man is not supposed to cry. So that's the masculinity thing going on in the society. But we feel the pain. We have problems. If females in our society is having abnormal menstruation, abnormal, like anything related to reproductive system, these people have a doctor, a gynecologist. What do we have? A general medicine practitioner, or the quacks that are sitting on the roadside giving all the medicines and asking you to chant mantra and everything. That will not work. So this anxiety is keeping these people not coming out of depression. People are not willing to talk on this. And the education system, the sex education in our society has a great barrier. Like I remember my biology teacher skipped the reproductive system.
Oh, wow.
They did not teach us. Why? Because it was a vagina, it was a penis, diagram made in that. So we were asked to skip the papers. We were asked to skip the pages. That's the gap that we have. From there, the education system, from there, this anxiety, this barrier is made. And this barrier goes on for the long life of this. So I think so that's where people are taking a back, on their back foot because of this anxiety itself. But now, after all the talks that we are having, with the help of you, moreover, and whatever I have done and people have done in the past, with the help of podcast, people are able to relate. People are able to relate, and webinars has played a huge role in this, because 100 people in one screen, when I see 100 patients in one webinar, in one screen, and when one person tells, I'm not the only one losing erections, anyone can have it.
Yeah.
So
yeah.
if that kind of approaches can be moreover inculcated in the society, that and these jhola chaps, moreover the quacks sitting in the market, these people need to think that what they are doing with the patients. It's not just money. It's not just business. It's someone's life that you are playing with. If you tell, go on masturbate for every day, that's wrong. That's somewhere wrong. The thought of it is only wrong. So with that, people have to evolve. With that, people have to think about their sexual health, and moreover, think about their partners, because ultimately they are not suffering, their partner is suffering.
Yeah.
And they won't say it. In India, female really respect their men. And when you say respect, they won't say you are not enough.
So maybe you can help us to understand what is the situation of sexual health today in India. Paint us a picture.
So, at any point of time, when you have, I'm going to start at a very basic level. At any point of time in their childhood, if anyone has an infection on the penile organ or on the testis, these people will not tell anybody. These people will not go to a doctor because they have to take their underwear down. No child, no person or man can take their underwear down before their general practitioner. It's a difficult thing to even keep your underwear down before your mother or father after 12 years of age. So how to go ahead with that? So these people tend to handle their infection, put oils, put anything and everything, and getting to the medical store, asking these pharmacist people what to have. So from this scenario to the scenario of when they are getting married, or when they are coming into a live-in relationship, or when they are getting onto the sexual intercourse part, these people are having somewhere, some people are having loose erections, some people are getting ejaculated on at the time of foreplay itself, some people are not able to penetrate only. There are sexless marriages going on for 5 years, 7 years. And how we are getting the cases? Sir, we want to conceive, we want to go ahead with your IVF procedure. When I ask them, why IVF? Tell me about a history. All the reports done, within 2 hours, everything is on my table. All the nerve conduction reports, all the blood reports, everything is on my table. Semen reports, we have the highest technology of semen analysis. So within 60 seconds of the handover of the semen, I have my report on my tab. And that's an AI-based report that I have. People are able to see their semen moving ahead. So along with that, I am able to see everything is fine with you. Why IVF? Then after a long counseling session, these people are telling, we never had an intercourse.
Wow.
So that's alarming. If these people can ignore this part of their life, what are they doing? So this is to be taken care of. This is not respect. This is just stupidity that people are having. Not coming up with their problems, not letting anyone know what's going inside their life. And when they end up getting divorced, when they end up their marriages, nobody knows if it will be a very a dirty divorce. Then people will say he is an impotent, people come to me. People say, sir, please give us certificate that I'm not impotent.
Wow.
I have to place in court, just test me off. There are a lot of things going on in the society, needs to be taken care of.
But help us to understand what's the root cause of what you are telling us.
So
what do you think?
Root cause is somewhere lack of knowledge. How to handle a minor cut on the penis.
Yeah.
Here in the studio, nobody would know it. But how to handle a minor cut on your hand, everybody would know it. Just put some Dettol on your skin and just put some soframycin on your skin and it's done. But can you apply soframycin on your inner side of your mouth? Yes or no? No. The skin on the penile penis is the same as your mouth. So we can't put it there. So people tend to taking their symptoms out of their hands with applying anything, steroidal creams and everything there. So root cause is lack of knowledge. How they are supposed to have the sexual activity, what they should expect out of their partners. They are trying to imagine the porn with their partners. Are they going to get that? Are those cuts in the porn, a 3 hours porn, are those cuts going to really relate with their private lives? No.
Wow.
They are all papaverine injected with in the porn stars. Are these people going to stay erect at the normal immunity level? No. So that kind of myth, that kind of depression is overpowering their mind. And if it is overpowering their mind, it is somewhere going to a depression end. Okay, I'm not able to perform. So it's just lack of education. Everybody has power. All the patients, like I should tell you, 70% of my patients, blood reports are perfect. Mental health is perfect. Even these people are so successful in their works, so successful. Big time CEOs, big time IAS, PCS, everyone is there. But they're not able to perform. So somewhere these things are to be taken care of, and wrong information is to be bypassed. Because anyone is trying to have a YouTube knowledge, mix this, mix ginger, mix garlic, mix this, have this in the morning, and these people are blindly following that without knowing what temperature you are living in, what is the humidity, will it support your body or not. That's the part of a practitioner. That's what he is taught for 5-8 years, just to assess. When I see the patient, we have the whole scanning going on in our eyes. It's not just what you say, it's what we feel. That's what the experience of a practitioner is all about.
So there's a lot of lack of information, right?
Right information, moreover.
Exactly, the right information. Myths that are there about masturbation which are not true. Can you just share?
Masturbation, if done every day for 3 times, can increase your penis size up to 10 inches.
Wow.
This is the biggest myth in the market.
Okay.
Masturbation, if done very frequently or every day, will give you a longer penetrative sexual time.
Wow. Okay.
So people tend to masturbate before having sexual activity. That first time will be a very like just once, twice, and I'll have the ejaculation. And second time, I tend to be there for a time period of 10 minutes, 5 minutes. So this is a myth. This is actually a problem. Ejaculating at the first sexual activity, penetrative intercourse that you are having, is a problem. Is considered under vasculogenic erectile dysfunction. So basically there is one vein, one artery that is supposed to take the blood to the penis.
Yeah.
Till that level, everybody is fine. Everybody is having erections. But there is one vein, numerous veins that are supposed to take the blood back from the penis. So the retention power, when hindered, when the penis is not able to sustain their erections, that's when there is a venous leakage. And even a 1% or 5% of venous leakage can make your penis ejaculate.
Oh, okay. I see.
So that kind of a thing, I don't know if I'm able to explain in a best possible layman manner, but the coming and going of blood circulation is all about the penile health. And when you talk about having a sex for the second time, having the sex for the third time, the penis will be loose at least 5 to 10%, will not be at its 100% erection, will not be at its 100% tightness. In turn, you tend to feel less. In turn, you tend to feel like a machine that is going on to and fro. In turn, the partner, who is the receiver, is faking the orgasm. Because she is not able to feel the 100% tight erections. Because vagina, being a muscle, can be just like with this elasticity, but it can take out a whole baby out of it.
Yeah.
So the level of elasticity you can understand, And if the penis is even 5% loose, do you think that vagina is going to respond?
I see.
So people are not accepting it. People are just trying to be a machine, a beast, a pseudo beast, moreover. So these are the myths that people need to know. Even 10 times strokes with good erection can bring a female's orgasm. Even 10 times with 100% hard erections. But it depends body to body. It depends on the satisfaction level. It depends psychologically. Where are you comparing this sexual activity with? Who are you comparing it with? And mostly in India, people are not having a lot of comparisons. And that's good. That's very good. For the mental health, there are a lot of compromises, a lot of sacrifices that makes the relationship go strong. And if it is nothing to compare for that reason, that's a good thing.
Yeah, that's what you say. What it becomes unhealthy when you start comparing, for example, with porn, or then the expectation is very, there's a big gap. Okay, cool. I think we busted one myth around masturbation. Now about porn, what are the short term and the long term effects of watching porn?
So watching porn totally depends, the effects of porn moreover on the brain generally depends on the intellectual level that person has. Generally depends on the experiences that this person has. It cannot be same for everyone. Some people tend to consider porn as their real life. Some people expect those foreplays, those role plays, those rounds, those hours in their real life. And these people also get implants done to match that level.
Really?
Yes. People are coming on to me, sir, I want to have a 3-hour sex. Just give me an implant.
Okay.
People are like from there, this is their understanding. This is their basic understanding. I have a security guard who is coming to me for the implant. A security guard, a general security guard. He is saying, I will be able to pay 2 lakh rupees, sir. Just get me an implant, sir. You understand, that is a level. On the contrary, this person who is a laborer wants to gain a nice relationship with his wife, wants to have a good sexual life naturally. So it depends what is your overall experience of life, what is your overall comparison levels, what you are fascinated for, and what are your goals. Simply your goals decide what over exaggerated or overtly fascinated you are about things. If you are a nice, successful man, a nice, decent earning man, they have different goals. They have a house to buy. They have a dining table to plan. So these people will not go on to a trap of these porn activities. On the contrary, we talk about rich people's kids. These have a different kind of fascination for porn. These kids are coming to me and telling me what not. They have their photos, they have their sizes, they have their targets. They want certainly these things on their organ. So everybody coming from what background, it depends what kind of fascination level these people have. And I have a lot of people who are a good businessmen are not even having sex in their life. Are just doing business. Its just goal is to earn money. And their wives are also spiritual, at a spiritual end. These people are also not wanting to have any kind of fascinated sexual life, trying to be a nurse for their husband. So moreover, they have a complete they have completed their family, they have a nice car, they have a nice business, everyone is happy, the grandfather, the grandmother is sitting in the house. That's it. No sexual activity, dead sex life for 10 years. I have those patients as well. And after 10 years, when they realize I have done everything, earned everything, but what about my sexuality? Then it is striking, the reels that they are able to see, the podcast that they are able to hear. Then it is somewhere striking them, I have missed it. Let's keep this a priority. Then these people are consulting me. It's not that they have been in depression for last 10 years. It's just that realization.
But like for people, if people watch too much porn, what can be the consequences? Not just physically, but also mentally and emotionally.
So moreover, people watching a lot of porn, because porn is really addictive. It's more addictive than cocaine. Porn on a whole leads to people getting these masturbation things going on for 5 times a day. So this is where porn is hindering the mental health of the person. If they are having 5 times masturbation a day and watching porn every time, watching erotic content for day long, because right now at our age, the erotic content was not available. It was very hard to find. I don't know in US how it is, but here we used to buy CDs for internet. For 200 MBs, we used to buy CDs, and we were not supposed to watch anything on that. We were used to do our school projects for that reason. But right now, the level of accessibility of porn is somewhere keeping people addicted towards it, letting people discharge their seminal fluid more often because of the accessibility. In turn, these people are having looseness. These people are having Dhat syndromes also.
What is that?
Dhat syndrome is basically the precum that you see releases from the penis every time you urinate.
Oh, yeah, okay.
And that's somewhere a problem, because people lose their health, lose their overall fat level of the body, and gradually when this hormone is discharged at a fast pace, these people tend to have mental issues as well, like dementia, these people are not able to concentrate. A lot of children are coming to me that, sir, I have masturbated for 5 years now. I am willing to get into IAS. I am willing to prepare for civil services. I am not able to concentrate, sir. This nightfall is hindering me like anything.
Shit.
So these are the problem these people are having. These are just 17 years old. But when they are preparing for civil services, they have their different goals. Stopped porn, stopped masturbation, stopped everything. Just focusing on civil services, trying to be an IPS, trying to be a IAS. And when these people come to me, this really shows if you have different goals, you can really support your health. You can not go into a fascination world, and moreover, you can go on a successful end where you will be successful with your wives as well, at your fertility quotient as well, and in your career also.
I see. So basically, what you say, I mean, too much porn can impact not just physically, right?
But mentally as well.
But also mentally can have a big impact. Good. To close this topic, is there any other big myth that you see people coming to you that you would like our audience to understand?
So, porn has a relation with gymming. These gym trainers tend to know everything about their clients, and these people start their PCTs. PCTs are basically steroidal injections that can gain muscle size. After all these PCTs, after a lot of sessions, these people are trying to get those bodies, those masturbation ratios are getting higher for them, because trainers are telling them to masturbate.
Really?
Trainers are telling them to have regular sex, Trainers will tell them that you take testosterone injections, you have sex, your testosterone will shoot up.
Wow.
And for their support, for their literature, they have the full porn industry levels that you will gain this level. This is the body, this is the penile size, you will gain this if you do 2 years course with us.
Oh, I see.
And in this 2 years, these people spent lakhs of rupees on these trainers. So no offense to the people who are genuinely training people.
Yeah.
But all the offenses to the people who are misguiding people on the basis of these porn, on the basis of these videos, and making a pseudo fascination for these people. So it's different. And this myth of PCTs and steroid injections that can be taken, yes, under a medical supervision, yes, for a profession, yes, but for just to look aesthetically good, no. That will somewhere kill your sex life.
I see. Good. Okay, we kind of have a lot of myths that we already busted.
Yeah.
So now let's understand what are the most common sexual problems that people come to you for support.
So basically the primary, the most common problem is premature ejaculation.
Oh, really?
So sir, I tend to discharge very early. So under premature ejaculation, there is oversensitive glans problem also. That these people say, sir, my glans area is so sensitive that even if I touch or my partner touches that glans area on foreplay, it will discharge without even penetration. So this is the maximum of the patient are complaining about this. And the second most problem that these people are telling, sir, primary 5 years, I was never having any kind of erection problems. But gradually, timing was an issue since starting. The premature ejaculation was an issue from starting. But gradually, the erection is lost. The erection level is also loose. The erections are very low. I am not able to feel the power inside me. So premature and delayed erections are the two basic problems that everyone is having.
What are the reasons for the premature ejaculation?
Like I just said before, premature ejaculation is somewhere related to blockages. These blockages are veins dependent, vasculogenic moreover. If the penis is not able to hold its erection for a longer period of time, if there is a venous leakage in the penis, then you will end up getting the semen discharged at a very early pace.
But what's the reason for that to happen?
The lifestyle disorders.
Okay, tell me more about that. Yeah, tell me more.
Lifestyle disorders, moreover, all the packaged food that you are eating, all the chips, you're taking the packet, you're opening and the chips that you're eating, it's all palm oil. The palm oil is the main reason for all kind of gut problems, all kind of glucose, these diabetic problems, all kind of hypertensive problems, heart attacks, and now penile dysfunctions, sexual dysfunctions. Yes.
Shit.
So whenever we do on these apps, we tend to have easy foods.
Yeah.
From there the problem is starting. Because there is no controlled oil that these people are using. Obviously this is a business for them. These people will do all the cost cutting that is required.
Yeah.
And palm oil is the cheapest, and palm oil is the worst oil on earth. Because it leaves those free fatty acids in the body that end up clogging your veins, end up giving you heart attacks, ends up giving you depression.
Really?
Yes. Palm oil is very much, right now there are a lot of studies, right now people in India are a lot taking care of the oils, omega-3 fatty acid, fish oil, ye wo. All marketing. What is important is you should have regular oils like mustard oil, like ghee, like peanut oil, like sesame seeds oils. So all these oils are like naturally processed, but the majorly all these oils are not in their proper state. All these oil have their longer shelf life. And these oils, when you process them in your house, like we are Jains, so we follow a 3 days thing. We cannot eat the spices which are 3 days older after grinding. So all these practices are related to what you put inside your body.
Yeah.
You have to keep a check what you take inside your body, what you are eating, how much you are eating, and at what level you are eating outside your house.
So you also talk about lifestyle. What about is there a correlation also between the mental and also the premature ejaculation?
So basically, metabolic syndrome comes under 5 major things. So that's cholesterol that's affecting your body, that's hypertension affecting your body, that's diabetes affecting your body, that's thyroid affecting your body, and now that's sexual function affecting your body. Okay, majorly people with diabetes are having sexual functions. I don't say this that diabetes tends to lower down your libido, but diabetes has a role to play in vasodilation. It does not let the vein dilate that much that a normal body should do.
Okay.
In turn, getting your weak erections. In turn, your mental health goes down. When there are a lot of failures in once, twice, thrice, your mind does not let you go down that road. That's where depression comes into mind. And when I was talking about food, food has different wavelength. Whatever you take inside, like you are a vegetarian, people are turning vegan. Why vegan? Because there is a pain related to milk. You tend to exploit cows. So there is a pain. So there is negative like vibes from milk to the vegan people. That's what they understand. They understand the pain. They don't want to eat the pain. Like you have in non-vegetarian foods, you tend to kill that animal. So that pain, so that wavelength with our mind is somewhere hindering our mental level also. And there are studies in Germany right now happening. People are turning vegan, people are turning vegetarians, people are getting better, people are getting healthier. So all these things is somewhere involved with your mind, is somewhere involved with your overall positivity of your body, is somewhere involved with the performance that you are getting in your sexual activity.
So for people who are suffering from premature ejaculation, what are the 3 things that they can do in order to improve?
3 things, if I tell you now, this would be a 98 years experience that I'll be telling you.
Let's go.
So what my great-grandfather has understood, has experienced, my grandfather has experienced, and my father has experienced, and I am able to experience with my patients for last 8 years. It's all related to your gut. It's all related to your gut. If your gut health is nice, if you are not having any kind of bloating, if you are not having any kind of like constipation issues, if you are not having several loose motions, if your gut health is fine, then it is very most likely it is most likely to happen that you will not have any kind of sexual problems.
Wow.
Because my great-grandfather started from digestive problems. With solving their digestion problems, he was able to solve their sexual problems. But as the time took ahead of its technology, of its sedentary lifestyles, there are a lot of things added to our medicines. A lot of research is developed, a lot of things are developed. So one, keep your gut health in a best possible fashion. For that, you will have to replace your general diet with 50% of green leafy vegetables and a lot of colors of food.
Yeah.
Green leafy vegetables, if replaced 50% of your diet with fruits and moreover raw fruits, not the juices of it, it can somewhere make your gut health better within 10-15 days of administering it. It can make your body toxin free. And if it is toxin free, you tend to feel more energetic with your body. You tend to feel more powerful. Second, the timing of food. If you are going into a sexual activity with a light stomach,
Oh, I see.
after 3 hours of food, if you are going to bed and if you are having a sexual activity, most likely it is going to be a very successful activity. But what people are doing? Just the opposite. People are eating and going to bed at 10, 11, 12 and failing with their health, and mentally they are depressed. In turn, they are having physical problems. And most importantly, Brahmacharya, the NoFap culture. If you practice Brahmacharya as a day-to-day practice, as a day-to-day part of your life, a day-to-day targets of your life, you tend to save more energy, you tend to save more positive front, and you tend to be more inquisitive about the sexual life that you're going to have. In turn, Brahmacharya will give you a better sex life. That's all written in books. Since ancient time, it's all written in books. And if people are following this, just the diet, just the timing of food and Brahmacharya, it's not every day that you should have sexual activity. You can't have it. You have different goals, you have different mental level that you need to attend. If you follow, okay, these 3 days are for my sexual life, rest of the days will be Brahmacharya. If you would require it also, okay, if it is not the day I decided I want to have that sexual life, you will not have it. If you will not have it, you tend to have more inquisitiveness for the next day. You will gain erections. You will be in a very happy mood because it is planned. It is an understanding between your partner. The partner will be waiting for you wholeheartedly. It will be no communication gap. Because when you are married, there are a lot of things more important than sex. There are parents, there is food, there is EMIs that is on your head. But with all that mental setup, and wives are also working moreover, they are also having their office tensions. But if things are sorted, Saturday is our day. You tend to plan for it. You tend to be more enthusiastic for it. So this is something that you should practice in day-to-day life. It shouldn't be with everyone because it's exchange of energies. You can't have sex with everyone. What if the next person is a very negative person? You tend to become negative to your home and tend to fail with your wife or your partner. What is the end? Mental health issues, depression. pylons. We need to take care of that.
Okay, so three things that you meant. First is about a good gut health.
Yes.
Right? So the second is about the timing.
Timing
right?
of food.
Timing
That can
of
also
food.
reverse hypertension,
Exactly.
diabetes, thyroid.
Yeah.
The timing of food, a lot of intermittent fastings and everything is there. So that's what is the timing of food.
Yeah. And then the third one is more about you plan for it, right?
Brahmacharya.
Brahmacharya. Tell me a bit more about it.
So Brahmacharya is basically in Indian mythology, in our books, what it is written, you should not ejaculate more often. You should practice Brahmacharya like 15 days a month. You should not be that much sexually active every day. You should have those days when you tend to have those days that you will not have any kind of sexual activity. This comes with the spiritual thought process. When people are fasting, these people don't indulge into any kind of sexual activity. When people, like how my Dadaji says, langot ke pakke rehna. So this is the word. My Dadaji said it to me when I was 8 years old.
What does it mean?
It means you just can't lose your underwear before everyone.
Okay.
You tend to choose, you tend to have your partner. So that's what langot ke pakke rehna. And if there is less comparison, if there is, because many times these negative people, I have these patient after 10 years of their sexual life, this person told me that I had one partner, sir, 10 years back. This partner told me that you don't have a good size. And after 10 years, I have this courage to tell you, sir, if I am having a good size or not. So that thought in his mind was wandering his mind for 10 years. When he came to my clinic, I gave him a clear report that your size is perfectly fine. But mentally, he was so depressed, sir, I'm not able to satisfy my wife because my size is not good. But his wife was very much satisfied. He called his wife and asked, like, sir, please get on with a counseling for her, sir, please. So I asked her, she said, I'm perfectly fine.
Wow.
He keeps on saying it to me that my size is not fine, size is not fine. That is keeping him depressed. And because of that, he was on some antidepressant medication.
Wow.
So this is happening to a lot of people. Some person may tell you their thought at any point of time. But what about that thought is not even real, but that tend to put a stamp on your heart, put a stamp on your brain for the lifetime that this is your problem. So somewhere these are things that where Brahmacharya is involved. That you need to exchange your energies, you need to exchange your sexuality, your thoughts to certain people which you feel is good for you. Not just a one-night stand, you tend to find a partner, this partner comes on. So this is where Brahmacharya plays a role, to have a proper planned sessions for ejaculation, a proper planning for sexual intercourse, a proper time, a buffer time moreover, a window period for not ejaculating more often.
I see. And so maybe now for our audience to understand, so what good looks like. So what is a good sexual health for every person?
So basically a good sexual life is having good size, having a good erection of 20-25 minutes without any discharge, and a overall sexual timing along with foreplay and intercourse and penetration of 20 to 25 minutes ranging to 40 minutes as well. I don't say this, you have to go to and forth for 40 minutes. It's unlikely, unreal. It's somewhere foreplay is 5 minutes of sexual activity, 4 minutes of sexual activity. When you guys are ready, when there is optimum fluid in the vagina, optimum precum on the penis, then you guys are having a good penetration. That can be repeated and taken forward with position change. That can be taken forward with a good foreplay again. If that is a 20-25 minutes time that you are having, both the male and the female are having a good orgasm, they are happy. If the size is going more than 5 inches or 6 inches, it's fine. Don't be in that myth that it has to be 8 inches, it has to be 9 inches. Nothing is like 8 inches. Somewhere it has to range between more than 5. Yes, it is an optimum size. If it is somewhere down below that, you have to consult a doctor. If you are satisfied with 4.5 inches, your partner is satisfied with 4.5 inches, it's totally fine. It's upon what you feel for. So when you talk about good, it's a successful sex life where you and your partner have a good sync between this part, and if this sync is giving you a good orgasm, you guys are happy in your marital life, in your live-in life, or whatever, it is a good sexual life. There is no reason to compare your sexual life with anyone in the world, because it's the thing between two people, not several people.
Mm-hmm. Okay, so what you say is anything between 20 minutes to 40 minutes.
It's fine.
It's a good time that gives, and both can have an orgasm.
Yes.
What about if the woman cannot have an orgasm?
So it depends. The woman can have problems. It can be elasticity related problem. It can be dryness problem. It can be somewhere related to leukorrhea also, where the female has white discharge, curdy discharge, or smelly fluids coming out of their vaginas. These are some, or maybe there are some polyp.
So because you said it, like both can have a nice orgasm, but what happens when the woman cannot have an orgasm?
So there are some reasons that makes the woman not able to have an orgasm. That is primarily, it can be a sexual dysfunction from the male side. He is not able to penetrate with that level of hardness, or his retention power of the blood flow in his penis is not that optimum to be able to penetrate and go to and fro inside the vagina. Or moreover, the girth of the penis, the size of the penis may not be optimum enough to rub all the 4 walls of the vagina.
Oh, I see. Yeah.
If that is the problem, because vagina is all made up of nerve endings. It has a lot of nerve endings. The clitoris part of the vagina has a maximum level of nerve endings, because when you touch that, you tend to feel good. You tend to feel very like electric about that. So if that is and lack of foreplay also. If it would be a direct penetrative sex, women tend to have a delayed orgasm. If there is a good foreplay, that's what I said before. If you are having a 20 minutes of sexual session, sexual life, there should be at least 5 to 7 minutes of foreplay, 10 minutes of foreplay involved in whole of your sexual life. It is not just getting to and fro like you see in the porn. So there are multiple reasons. One, I have explained that it is somewhere the problem from the male side, that is sexual dysfunction, and the other pathological or clinical problems can be seen as dryness or leukorrhea. There can be some fluid, some infection, some curdy white discharge or yellow discharge. some kind of gonorrhea, chlamydia, something involved with the flora and fauna of the vagina, and there can be dryness, right? Dryness is the major concern of a female for not being able to have or attain orgasm. For these, generally symptomatically, people prescribe all the gel, all the these orgasm fluids that the market has. But this is a point of clinical evaluation for a gynecologist to take care of that first, and she will again gradually gain the orgasm back. But if you ignore that, that can also invite infertility in the female. So these are the some reasons why the female is not able to feel that kind of orgasm every time that when she has a sexual intercourse.
And what can a female do in order to improve the sexual life from that perspective?
So from that perspective, I'm going to give a good example of my book that I have recently written. That the title says Foreplay, Roleplay and Rounds. So foreplay is a two-way thing, but roleplay is not a two-way thing. You can change your perception, what you see in every day. You can't be that housewife that your husband saw in the evening when he was having food. You can be a nurse in the bed.
Okay.
You can be you can role play about everything. You can be his secretary. You can fool around with him. You can have a different level of fascination. If these role plays are there, and in our Indian society, these men tend to buy these lingeries for their wives. And with this, these people consider a new zeal for a sexual life, a new role play part for the sexual life. So you can spice up your sexual life in any means, but it is always not dependent where you are doing, if you are on a vacation, if you are not on a vacation. But general role plays can spice it up, and general patting effect also, that you give a good massage to your husband, or a husband gives a good massage to their wives. These things somewhere exchange the energies, the good energies and the caring thing, and in turn you guys sync together. In turn you get a better orgasm than before. So that respect, that care, or that role plays can make things spicy, or can make a better difference towards a better sexual life.
I really, really like it. So start with the foreplay and then role play.
Role play.
But what I really like is that then you start having a stronger connection.
Yes.
Energy.
Sex is not about good penetration.
Yeah,
Sex is about a sync.
Yeah.
What you feel about your partner, what you feel about your life. That's what is sex.
Yeah. So I think then what can be done in order to increase that sync, which, by the way, will improve the sexual health of a couple?
So sync can be involved in multiple ways. Even if you guys can have an evening walk together after completing everything, if you can have a 1 hour of evening walk, if you can have a couple yoga thing. There is this nude couple yoga thing going on, and this is working crazy. This is working crazy. Trust me, there are certified trainers that are working for it.
Okay.
Like you don't overstretch your body or something.
Yeah.
There is a sexual yoga going on. There you are not allowed to penetrate. They will give you a very hard time. You are not supposed to penetrate.
Okay.
But that sync is making the change that these people are telling me, sir, I have never had this kind of sexual activity with my wife. And it went for, sir, 1.5 hours.
Wow.
We were having yoga, we were having sex, we were having a lot of things, foreplays and everything, and we are just going on with that because that's the sync, that's the meditation that they have like processed for. And if this is happening, and ultimately all the activities are all related to the husband and wife or the partner's thought process to match. If the one partner is having business load, or this partner is thinking that you have not ironed my clothes, I'm not going to forgive you for this. If this person is saying you have not packed my bags, if all these things are going in your mind, how are you supposed to have a good sexual life? And if 1 hour walk will exchange everything, you tend to feel very much normal, very much equal. You tell your problems, you tell your fascination, you tell your experiences for the day. And when you go back, it's a good 3-hour gap after the food, you have a wonderful sexual life. Just by practicing that. It's so easy. But people are not doing it. People are wasting time at gyms, in that AC anytime, in the night, in the day. No, you don't need that. You don't need a six-pack ab for your wife to like fascinate about. You just need an emotional balance between the two partners. It's just so simple. Even if you are ejaculating early, your wife wouldn't matter. It wouldn't matter to your wife. You can have rounds. It's not a problem. It can be taken care. But if there is no sync, it will be a complaint then. And if there it is that is a complaint, it will hit the mental health of the person. And if it will hit the mental health, you end up having antidepressants. And what are antidepressants doing? What are these quick action pills doing? Letting your heart with more pressure. And if there is more pressure, you tend to have a heart attack. So everything is interrelated. It's just some meditation, just some talks, emotional balance will take care of everything possible. But that is not easy. You need a professional support for everything. For that, a lot of good doctors are sitting in this field. My counselors who are attending 500 calls a day. 500 calls a day. These people, I have guided them. Just tell them to heal themselves at their level. Just tell them to change their lifestyle for 10 days and then take a consultation with me. If they are getting good changes, these people are taking care of themselves. They don't need to consult a doctor. There is no pressure that is involved.
I think we started this conversation a lot talking about the physical part, which you explained a lot. And now you ended up saying that it's all about sync, right?
Sync, yes.
And I really like that. So to finalize, maybe what would be one thing that people can do in India that would improve a lot the sexual health of the country?
So one thing that I see is stop fooling around. Respect your partner. If you tend to not fool around with different people, you tend to save many infections that you are getting. And if you are not indulging with anyone and everyone, then you are indulging with your partner. And if you are indulging with your partner, you are having a very good mental health. Because ultimately, your family is the support. Nobody from the bar, from the cafe that you hooked up with will come in your mental distress. The person who will be there is your partner, your wife, your spouse, your fiance. And if that is happening, if you have that kind of respect and that kind of a higher level for your partner, then somewhere things can be more productive, more spiritual, and to a better end.
Very good. Okay, so I'm very happy that we had this conversation. I think there's a lot of misinformation about this topic, and even we need more knowledge about this topic. So I'm very, very happy that we had this conversation to bring more awareness
Yeah.
towards sexual health.
Yeah.
Thank you for coming.
Thank you so much.